Continuing our series on common foot injuries, next up on the list is a neuroma, sometimes called a Morton's neuroma. This is pain that's going to be at the balls of the toes and can be very uncomfortable for people. So if that sounds like something you're experiencing or something a friend has described to you, stick around so we can talk about what it is and some options for what you can do to treat it. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal pain and injuries, meaning our treatments don't involve the use of surgery, drugs, long-term care plans, and one of the things on our list is foot pain. That is something we commonly treat in the office. So let's first start off with what is a neuroma. So if we're looking at this diagram of the foot has a lot of bones and little joints within it. It has these shaft-like bones or almost finger-like bones called the metatarsals. Those are going to provide a lot of structure through the arch of the foot. And then all of these little yellow lines that you can see in between those represent the nerves in those areas. So the foot is a very highly innervated region. It is what is primarily interacting with our environment. So we need a lot of input up to our brain. So that's why there's so many nerves down in this area. Now, with so many nerves in the area, it's also going to allow for irritation. So the neuroma itself is going to be one of these nerves, typically between the second and third toe or third and fourth toe. It's going to be a thickening of that nerve or a little bit of a scar tissue or adhesion around that nerve, which causes that burning pain, that persistent dull, achy pain, or sometimes even sharp pain if you put direct pressure on it. Patients will often describe this pain as feeling like there's a rock or a pebble in their shoe, or it might feel like your sock is getting rolled up or folded in the shoe. So it's just kind of this consistent aggravation in that area. Now, in terms of treatment, one of the first priorities is obviously going to be pain management and getting that sensitivity off of that nerve. So one of the big things that we like to focus on first is mobility of all of those little joints in the feet that we were talking about earlier. So that nerve is getting squeezed in between things. So we want to make sure that those joints are moving properly, so mobilizing all those little joints. After we've mobilized things, we want to strengthen and stabilize all of those little muscles in the feet that help hold up that arch and help us go about our everyday movements throughout the day. Now, on top of that, there's also great therapies that we have in the office, like our laser and our shockwave, that can help reduce some inflammation around that area, as well as break up any scar tissue, adhesions, anything like that in the region. And this can be a game changer in terms of getting that pain under control and making the movements that we prescribe much more palatable. If this sounds like something that you're experiencing, or you've heard a friend or loved one talk about it, I would invite you to check out our website at TruMotionTherapy.com, where we have more information, more resources, videos, as well as the ability to schedule an appointment with one of our providers. And we would love to do a thorough evaluation, make sure that we're getting the right diagnosis, and get a good treatment plan going for you, get you back doing all the things that you love.